Welcome back to Focus on Health. I'm Lauren Buck, Revere's Director of Public Health. It's great to be back with you all during the 2022 winter season. Today I have the pleasure of talking with Nicole Palermo, Revere's new social worker. I'm going to introduce you all to Nicole, and then we will talk a little bit about our topic for today's show, preserving and promoting our mental health around this winter season. First, I want to talk with you all about where Revere is in the new year with the ongoing COVID-19 pandemic. Let's address the biggest news headline since I was with you all last, the emergence of a new variant or strain of the COVID-19 virus, Omicron. There is still a lot we don't know about Omicron. At this point, we think the best way to continue to protect yourself is to get vaccinated. If you haven't started the vaccine process, now is the time. If it's time for your booster, making an appointment is vital. There is a huge demand for vaccine of all kinds right now, so you might be feeling frustrated when trying to register for an appointment. Please have some patience and remember to look at all of the different resources available to you. Most retail pharmacies have appointments for every type of vaccine, but the wait for an appointment right now could be all the way into February. I also encourage people to look at vaxfinder.mass.gov and revere.org/vaccine for other clinics. I want to remind everyone of the importance of monitoring symptoms and staying home and getting tested if you are feeling sick. Lastly, I want to remind everyone that you can do lots of things to protect yourself on top of getting a vaccine and testing. Remember to continue to wear your masks while indoor settings when applicable and wash your hands really well. These basic things will continue to protect you in the winter months. Okay, next up, I am very excited to introduce Nicole Palermo to our audience today. Nicole is the newest addition to the Health and Human Services Department as the city's first social worker. Nicole is currently working toward her mental health counseling licensure. I'll let Nicole tell you a little bit more about herself. Nicole, welcome to Focus on Health.
Thank you, Lauren. Hi, everyone. I'm excited to be here today and even more excited to be the first social worker for the city of Revere. I've just recently completed my master's in mental health counseling and school adjustment counseling, and I'm working this year towards getting my clinical license. I'm also a lifelong resident of Revere, and I really look forward to working in the community that I grew up in.
Thanks, Nicole. Let's start off by talking about protecting our mental health this time of year.
I think that's a great topic, Lauren. To start off on how mental health can be affected in the winter months, I want to talk about seasonal depression a little bit. It's absolutely a real diagnosis, and it's actually called seasonal affective disorder. It occurs during the late fall and winter months. Some symptoms can include feeling depressed most of the days, a loss of energy, loss of interest, feeling sluggish or tired, feelings of hopelessness or worthlessness, and just a general overall low feeling. On top of seasonal depression, the holiday months can bring a lot of stress to the table for many people. Some ways to protect your energy and your mental health this winter is to stay healthy. If you're not healthy, it's going to be very difficult to meet just your basic needs. Accept your needs for what they are at that time. It's going to look different for everyone. Sometimes people might need some safe socializing, and other times people might need a quiet space to just relax. Some people might need to get up and move around. Some might need to just stay in on a night on the couch. Whatever you choose to do, I encourage you to listen to your mind and body. Something else you can do to protect your energy is to set boundaries, which relates to my previous point. It's okay to say no to gatherings, and it's okay to just do what's going to make you feel good in that moment. Something else is managing your time. You will never have enough time to do all of the things that you want to and have to do, so making a daily schedule can help you feel less overwhelmed. One other thing you can do to protect your mental health is to eat well, get enough sleep, exercise, give back, write gratitude lists, and find extra support if it's needed.
Thanks for that insight, Nicole. I was wondering if you could shed some light on some of the resources that are available to residents who might be struggling around this time of year.
Definitely. If you feel like you're in crisis or are having suicidal thoughts or ideations, please, please, please reach out for help immediately. You can call the Suicide Prevention Hotline and speak to someone right away. You can also visit your local emergency room for immediate assistance and an evaluation. If you look to the bottom of your screen, you can find some resources. Some other great resources for less severe thoughts and emotions can be accessed right on the internet. There are websites for guidance on how to start gaining control of your life and happiness again. YouTube can be really helpful as well. Watching a video on how to control your thoughts or breathing is just some simple ways on how to regulate your body. Please, once again, look for the links at the bottom of your screen for some great websites to learn more about seasonal affective disorder and how to better your mental health this winter. Finally, I'd like to talk about some things we can actively do to keep our mental health protected during this time. You can literally do anything that will keep your mind busy and your body moving. If you can get up and do 10 jumping jacks right now, I challenge you to just do that. It will get rid of some of the anxiety and stress that might be built up in your body, and it's super important to move around if you're feeling down, anxious, or a little bit stressed. TIP, or TIPP, is a simple acronym that you can use almost all of the time. T is for temperature. Counteract the temperature of your body. Usually if we're feeling upset or anxious, our faces might get a little red, we might feel a little bit warm. You can put some ice on the back of your neck, splash cold water on your face, or just go outside for a walk since it is winter out. The change in your body temperature will help cool you down emotionally and physically. The I is for intense exercise. An increase in oxygen flow means a decrease in your stress level. So when you're getting to your breaking point, run, literally, or walk, or jump, or dance, or do anything to get your body moving and your blood flowing again. It might seem silly, but physically, it works to decrease stress from just sitting and building up in your body. P is for paced breathing. This one you can also do basically anywhere at any time. It's a breathing technique that will help calm your body and your mind. You would breathe in for 4 seconds or 5 seconds, however long you can, hold it in, breathe out for that same amount of time, and then hold. And just keep repeating that process until your mind and your body feel a little bit more relaxed. The last P is for paired muscle relaxation, and I find this one super helpful at the end of a day when I feel really stressed and I'm trying to relax my body, but I just can't let go of tension that it built over the day. Turn on some soft music, lay down, and just go through each muscle in your body, starting at your toes. Scrunch them up, tighten them, hold it for a few seconds, and then release. Do that same technique all the way up to your shoulders, and then your body should feel relaxed over time. Relaxed muscles require less oxygen, which will make your breathing and your heart rate go down. On the website that is linked below, which is sunrisertc.com, there are 5 other acronyms that you can learn about and try this winter or whenever you might be feeling a little bit off. My last and most important piece of advice is to remember that it's normal to get burnt out and stressed out over these winter months. It's okay, and please remind yourself that there is help out there and available to you if you need it.
Thanks so much, Nicole, and welcome to the team. And thanks to everyone out there watching and listening. On behalf of the Revere Public Health Department, thanks for tuning in to Focus on Health.